We start right now with a look at today's big developments in the coronavirus outbreak here at home and all across the country. And breaking right now, the mayor of Los Angeles now asking everyone in that city to wear a mask in an effort to slow the spread there.
Now here in Connecticut, a heartbreaking update from the governor this afternoon. A 6-week-old baby has died with the virus. Just absolutely so upsetting. This news coming as the number of people in our state with the virus continues to rise. There are now 3,500 confirmed cases, an increase of more than 400 from yesterday.
And today's news, as you can imagine, is changing the way some parents are now looking at the virus. Channel 3 Eyewitness News reporter Matthew Campbell begins our team coverage. He is live in Hartford with the answers parents are looking for tonight. Matthew?
Yeah, Mark and Aaron, we spent the night consulting with doctors, and they agree seeing the coronavirus inflict children and newborns to this degree is very rare, but they do want to know if it was the coronavirus that killed this baby. With each life lost, more families feel the devastating impact of the coronavirus. Tonight, we learned the virus may have stolen a newborn from a Hartford family.
Probably the youngest person ever to die of COVID has died here in Connecticut. That baby was less than 7 weeks old.
State officials say the Hartford newborn was rushed to the hospital after becoming unresponsive late last week. After the baby died, the sobering revelation: the newborn tested positive for the coronavirus. Dr. Stephen Choi works at pediatrics at Yale New Haven.
It's heartbreaking. I think it's too early to say what the baby died of. Being a pediatric critical care doc myself, there's a number of other causes that could have caused a sudden death.
We did ask if the parents were symptomatic or if the child had any underlying health issues. The state did not have that information. Choi does say while death is still very rare, what we're learning today may indicate children can be more at risk than we initially thought.
I was a little skeptical about some of the early data that was coming out of China, that there were no mortalities in children and adolescents. And we're already, in the first month or two of the pandemic spreading in the U.S., there are a lot of younger, healthy adults and some children who are getting very sick.
We're digging deeper into that data. A JAMA pediatric study looked at 33 women who had the coronavirus. 3 gave birth to children who were diagnosed. All 3 babies recovered. In Illinois, a child under 12 months died from the coronavirus. Dr. Summer McGee from the University of New Haven says this proves no one is immune.
My best advice for parents is limit your exposure outside the home as much as possible.
Now, looking at Connecticut, the majority of deaths remain in that over 70 age group. The death rate in our state is at 2.4%, and that is of all of those confirmed cases. When you factor in the presumptive positive cases, and those are also in the thousands, that death rate will go lower. That is the latest. Live here with the Mobile Newsroom, Matthew Campbell, Channel 13 News.